These are recreational vehicles that are intended for people who may have tested positive for COVID-19, do not require hospitalization, but do not have a place to stay, right? So they could be living in a congregate living situation such as an SRO, or they're experiencing homelessness. What the city is doing is we're making sure we have resources in place beforehand, before they're actually needed.
All right. All right.
That's all right.
Maybe this one has storage. What is it? The electronic.
This is the sleeping quarters, and then just around the corner here is the restroom. So the health and safety of all San Franciscans is our #1 responsibility. The important thing to note is that COVID-19 is spread through close personal contact, right? And so before we put these things in place, we're going to make sure we have a logistics plan, a safety plan, and a health plan in place to make sure that the people inside the RVs, as well as in the community, are safe.
The tents that we have out here, we're calling them the ACUs, so the accelerated care units. And what they're allowing us to do is really prepare for patients that might have coronavirus or COVID-19. So the way we've operationalized them is, first of all, they're military-grade medical tents. They are both negative pressure. And so what we've set up this is day 3, is a rapid triage system that's outdoors. We have a nurse, and every patient that comes through is quickly asked if they have any respiratory symptoms whatsoever, and their temperature's taken. If they have either of those, they are sent to the tents. If they don't have those, they're given a blue wristband and they're allowed to go into the main ED. What was happening, a couple weeks ago was we were worried about respiratory patients that potentially had COVID-19 being in our hallways and our waiting room. And we don't want our healthcare workers to be infected. We also don't want other patients to be infected. So this was sort of that process of trying to quickly separate individuals with respiratory symptoms to the tents if possible. If not, they'll be triaged to the ED, and as long as we have a private room, to kind of separate those two populations quickly.